Careblazer, this week's video is here by popular demand. I have received many questions about this topic over the years, but I have never done a video on it. Partly because I thought maybe it was too specific and narrow for the majority of our audience, and also because this topic hits close to home. We are talking about alcohol-related dementia, as well as its close relative, Wernicke-Korsakoff syndrome. We'll talk about the symptoms, age of onset, something called confabulation, which happens a lot in these conditions, as well as how to support somebody who has this condition. Now, let's talk about what exactly is alcohol-related dementia. Alcohol-related dementia is exactly what it sounds like. It is cognitive impairment as a result of excessive alcohol use to the point that it significantly impacts a person's thinking, memory, and behavior. One of the biggest risk factors for developing ARD is, you guessed it, chronic, ongoing, excessive, consistent alcohol use. It is possible that somebody can develop this condition after a shorter period of heavy excessive alcohol use. And it's also true that people who have a very long history of heavy alcohol use may never develop this condition. It's not like every single person with heavy alcohol use will develop alcohol-related dementia. It's just that heavy alcohol use is the biggest risk factor. Now, let's talk about the age of onset. When do people typically develop this condition? While the age can vary, typically people develop this condition between the ages of 40 and 60 years old. Now, when it comes to symptoms of alcohol-related dementia, many of them are similar to what we would see in other types of dementia, like memory loss, confusion, problems with overall thinking, but especially in alcohol-related dementia, we also see things like confabulation and coordination and balance problems in particular. Confabulation is when a person unknowingly creates false memories to help fill in the gaps of their memory. So when we don't realize confabulation is happening, what this looks like to you and me is basically we think the person is lying. We think the person is making something up. For instance, they might say that Princess Diana visited them today and they had tea together. It could be something totally outrageous like that. Or it could be something not so outrageous, like the neighbor next door came over and they had tea together. Neither one happened, but the person unknowingly is saying that to help fill in the gaps. They're not lying on purpose. Confabulation is a hallmark feature of alcohol-related dementia. However, we can see this in other types of dementia as well. When somebody has confabulation, it can be incredibly frustrating for the caregiver. Now, how specifically does alcohol-related dementia differ from Alzheimer's disease? Well, the main way they differ is the cause, the underlying reason for the thinking problems. Now, the thinking problems can look pretty similar, but it's the fact that alcohol-related dementia is literally due to alcohol. The other way this differs significantly from Alzheimer's disease is that right now there is no cure for Alzheimer's disease once somebody is diagnosed with it. However, for alcohol-related dementia, it is possible for somebody to improve and possibly reverse their cognitive thinking problems altogether by stopping alcohol use. That's not always the case, but it can be the case. In terms of what can we do if somebody does have alcohol-related dementia, the biggest thing that we want to do is to help support them in becoming sober and stopping drinking. However, it is so incredibly important that you do this with the help of their medical healthcare providers, because it can be deadly to stop alcohol use abruptly, especially excessive alcohol use. It can literally lead to death. So it has to be done with close medical supervision. Now, whenever we talk about alcohol-related dementia, there is another condition that you will always hear about. Do any Google search, and pretty much it won't take you very long to hear a term called Wernicke-Korsakoff dementia. This is something that can develop if alcohol use is not stopped, and the alcohol-related dementia will progress into this type of dementia, which is serious. This condition, as you can see by its name, is actually made up of two separate conditions. It's first made up by Wernicke's encephalopathy and then Korsakoff psychosis. If somebody has Wernicke's encephalopathy, we want to treat that as quickly as possible to help prevent it from progressing into Korsakoff psychosis. Wernicke's encephalopathy is a result of vitamin B1 deficiency, essentially thiamine deficiency. And so the medical professionals will want to try to treat that as quickly as possible to help prevent it from developing into this type of dementia. This type of dementia is sometimes nicknamed wet brain because it's largely linked to people who use alcohol excessively. However, it is important to note that some people can develop this type of dementia totally unrelated to alcohol use. As I mentioned, we want to treat Wernicke's encephalopathy as quickly as possible, basically by trying to replenish and restore the vitamin B1 levels as quickly as possible to prevent it from developing into Korsakoff psychosis and Wernicke's Korsakoff dementia. And there's three main symptoms that are signs that Wernicke's encephalopathy might be happening. One is that there can be really abnormal, strange eye movements. Two is really severe confusion, almost like a delirium. And three would be problems with their walking and gait. So when they're walking, they're totally not steady. And when we're talking about the eye problems, the abnormal eye movements, it can be that the eye movements are like moving uncontrollably, but it can also be that the eyes just aren't moving. Like all the dementias, they all share similarities. They have problems with their thinking to the point that it impacts their daily functioning. All dementias share that in common. Alcohol-related dementia is no different. It's just that there is a chance to improve if caught soon enough and the person is willing and able to stop drinking. Now, Careblazer, I know that sometimes this information is helpful and interesting to hear about, but if you're looking for a community of support, a place to receive 24/7 information, as well as connection with other Careblazers going through the caregiving journey, I highly recommend that you check out our care course, where we come together every single week to do support groups. We have live question and answer sessions where I'm in there helping you answer your questions. We also have dementia experts like elder law attorneys, board certified neuropsychologists, other geropsychologists, all in there with the chief goal and aim to help support you and help you get through this journey as smoothly, peacefully, easily as possible, and enjoy whatever time you have left with your loved one. There's a link below in the description where you can learn more. Careblazer, I'll be back next week. Let me know what other topics or questions you want to see answered on the channel. Bye.
Also, Nico gets a belly rub for every person who subscribes from this video. So if you haven't already, click the red subscribe button. It's totally free, and Nico says thank you very much.